Hello everyone, my name is Dr. Vaibhav Garg. I'm MD Medicine first semester resident at PGI Chandigarh, and in this video I'm going to talk about the last 10 days checklist for May INICET 2025, which would include the following three components: the content, the mindset, and the exam day strategy. In the content, I would like to say that majority of the things you have already studied at some stage during your MBBS curriculum, during internship while taking samples and deciding which vial to put blood in, while studying the 4.5 years of MBBS, which were rigorous. You have come across each and every question at some stage. So what is required is to just be calm and have a little bit of self-belief that if you will apply your brain, if you will try to remain calm during the exam, you will definitely be able to recall something or the other, and you would be able to rule out at least one option. Most of the questions can be decided by your basic clinical acumen, your judgment skills during the exam, and the practical knowledge that you have gained during your internship or while presenting your cases. For the rest of the 50% of prox questions, what matters would be last 3 months and more focusedly last 1 week before the examination, which would include the important lists, volatile information like named signs, procedures, incisions, the acts committees, like surgery classifications, the numericals of PSM, physiology, or pharmacology, and concepts which you have to apply during the exam, your pre-existing knowledge, and questions which are not directly asked and would take more than a minute probably. But yes, you have to apply your brain during the exam, and for that, you don't have to get overburdened by the huge amount of syllabus which remains to be covered. I think in the last 10 days, the must cover things are at least the last 4 to 5 years of PYTs, especially since the beginning of the INICET since 2020. You should try to cover the PYTs from them. If you are seeing the main notes or revision notes and you covering the PYTs in that, I would recommend that you should go ahead with it. But if not, then I would recommend that you should see PYQ explanations, especially the highlighted points and the pearls which are attached. They also are very high yielding and give a huge push to the PYT knowledge because at least they would help you to rule one or two options, and that would make you even more closer to the desired score. Just flip through all the 19 subjects, crisp, volatile, factual tables. Either you can use BTR or any rapid revision source, but focus on high yield tables, all the important named procedures, and just flip through all the pages once. I feel for INICT, the high impact subjects have always been basic sciences. It is heavily reliant on that. And in that too, in the last 3, 4 exams, I have noticed that anatomy has gained a lot of weightage, especially neuroanatomy, embryology, and cross-sectional radiological anatomy integration questions, and even cadaveric sections have been asked. Focus on biochemistry has always been high, especially genetics and lipid storage, glycogen storage disorders, pathology, pharmacology have been favorite subjects, and as always, microbiology. So these subjects are very high yielding and factual for most of you. So you should definitely not skip any of these. Also, minor subjects hold a huge weightage in INICET and they can focus more heavily on any of the minor subjects. So don't leave the minor subjects, especially opthal, ENT, orthopedics. They are very high yielding and you should definitely not leave them. You have to plan according to which is your weakest subject and the subject which is volatile for you and it is high impact subject. You should keep it closest to the exam date. If its subject is volatile plus low impact, keep it in middle of the last 10 days. If the subject is very high impact, but you don't forget it, you remember most of the stuff, you can keep it in middle. But if a subject is not volatile and is not so high in yield, then you can keep it in the initial few days, or you can club it with some major subject, like with a major subject like obs gynae, you can do anesthesia in that on that day. So that would be a good mix and match. Or if there is time crisis, then you can leave this low yielding subject also. In the last few days in passive reading versus active recall, I would say that sometimes you're not able to concentrate during the day and your speed is going too slow according to the goals which you have set. In that case, you can use some video lecture or some YouTube INICT must know topics or any short mega PTR revision kind of thing to speed up the momentum, to increase the speed of reading in between whenever you're feeling that you're reading slow, and to utilize each and every moment which you can. Because if you will delay and keep on piling up things, then last day uh, it would be very stressful and you may not be able to utilize each day adequately. In the last 10 days, active recall is usually not recommended, but you can do active recall of some important volatile tables or lists, and you can try to integrate the related topics or questions or PYQs in your mind using active recall, which has been asked from that particular topic. I would not recommend giving too many GTs in the last 10 days, but you can give one GT or you can give one GT 1 week before the exam. But giving a GT daily or alternate day would not be recommended. You should try to practice at least 50 to 100 questions each day. You can solve custom modular PYQs or PYQ marathon or any subject quiz test of the subject you are reading, but do solve some questions each day because you have to keep up with your practice of ruling out your options, which is the most important exam giving skill. Next, last comes the mindset. So you have to take your preparation to the last day. You have to study each day. It's not about finishing all the books. It's about studying every day in a planned manner and try to finish as much as you can because you will not be able to complete all of it. Even if you uh, study the entire day, most of the things you will not be able to complete, and it would be unlikely that all the subjects you'll be able to finish. So you have to just try to utilize each day to the maximum. Don't set undesirable. Oh, don't overburden yourself. Set some achievable goals and give timeline to each subject in how many hours you want to complete it. Plan your day in the morning when you get up and allot time according to the volume of subject. Weak subjects are going to take more amount of time. Minor subjects you can finish relatively quickly. So you have to divide accordingly. In the last days, often everyone has in the last few days, it is quite common to have confusion in what to read and what not to read. So whenever you are in this confusion, try to read what is more high yielding. You have to think from which topic many questions are coming. Read that topic which you feel that it is more likely that a question will be asked from this topic than the other. Don't try to know everything. Just read enough that you are able to rule out the options. Don't try to read everything, just read enough that you are able to rule out the options. Stop studying at 10 p.m. on the night before the exam. If you will try to wake up the entire night, then that would drain you physically, which you don't want. Even if you're not able to sleep, it won't matter much. Your sympathetic system is going to take care of it, and it doesn't matter whether you're able to sleep the night before the exam or not. But if you are not physically at rest, then it would make you feel more tired and might impair your exam day performance. You have to try to work on your sleep hygiene and set the body clock according to the exam clock. Setting your sleep timings and food schedule according to the exam day and eating healthy, nutritious food has some role which cannot be directly explained, but I would definitely recommend going for healthy and nutritious food. Next comes the D day, the exam day, of which everyone is scared. Even being the rank one in NEET PG 2024, I was scared during every exam of the entrance. But the mindset has to change, and the exam day mindset should be जो होगा देखा जाएगा, जो होगा अच्छे के लिए होगा. So even if you are able to make it and get into your desired branch in college, it's a good thing. But even if you're not able to do this in this attempt, something even better awaits. Maybe the next entrance is going to go your way, or maybe something even better lies ahead in your future. So don't get disheartened. Just try to utilize each day, each moment up to your fullest, and just believe in yourself. And I would say all the best to everyone.